Dr. Daniel Press, neurologist at Beth Israel Deaconess Medical Center, discusses Alzheimer's disease.
Alzheimer's disease has had a huge impact on society. It's estimated that anywhere between 1.7 and 4.2 million people in the United States currently have Alzheimer's disease, and the overall cost to society is estimated at roughly $100 billion in terms of care for patients, but also the burden on families looking after patients. Early on in the disease, the issues might be as simple as just helping mom or dad to balance her checkbook. But as the disease progresses, obviously a lot more care is required, all the way to the point where simple things such as helping someone dress and feed themselves requires assistance from a family member. There's also naturally the fears of a lot of family members that maybe they'll develop this condition later on down the road, especially for children whose parents have developed Alzheimer's disease. There's that concern about what's going to happen to them 20 or 30 years down the road. So there's a great interest for people in how to prevent Alzheimer's disease or keep it at bay. And there's been a number of studies of drugs which haven't all been proven all that useful, but there are a number of other factors such as diet, exercise, and mental activity which have shown great promise both in the lab and in studies in humans. I think a key point to make is when people are mentally active, it doesn't have to be any one specific activity. Patients often ask me if there's some specific computer program they should do, whether they should do Sudoku or crossword puzzles. I always tell them to stay mentally active doing an activity they actually enjoy. But the main point is that old aphorism about use it or lose it seems to hold true for the brain just as it does for other parts of the body. So risk factors for heart disease such as high blood pressure or diabetes or hypercholesterolemia, high cholesterol, all seem to also be risk factors for Alzheimer's disease. So while we're taking good care of those risk factors and it may help our heart, it may also help prevent Alzheimer's disease. We're starting to understand at even a molecular level why that might be. There's an intimate relationship between vascular problems and the proteins that build up in Alzheimer's disease. And it works such that if someone has even some vascular disease and just a little bit of Alzheimer's disease, it can cause them much more cognitive problems than if they didn't have any vascular disease at all. It's rather interesting that a lot of people can have a fair bit of Alzheimer's changes in their brain and have no symptoms at all. Their memory can be perfectly fine. And it may well be that those are the people who have particularly good blood vessels or good vascular health. They seem to be able to tolerate a far bigger burden of Alzheimer's disease in the brain without it causing them major symptoms. I see a lot of patients who are concerned about their possibility of getting Alzheimer's disease because family members have it. One of the first things I think is important to do is to ascertain how significant that risk is. If they have a mother or father who developed Alzheimer's disease late in life, in their 70s or 80s, then the likelihood of that person developing Alzheimer's disease is only slightly higher than anyone else. I try to reassure them that the risk is really not that dramatically great. Unfortunately, there are other people out there, although in the minority, who have multiple family members who developed Alzheimer's disease at a young age. And for those patients, we really work on minimizing vascular risk factors, staying mentally and cognitively active, and sometimes we even talk to them about potentially screening. Now, it's a very controversial area because there is no great screening test yet for Alzheimer's disease, but these people often stay right on top of the literature, and as tests come out, they really want to know about them because they are deeply concerned. And we try to, in an informed way, reach a judgment about what tests should and shouldn't be done.